Welcome to the 2023 NNLM Virtual Symposium on Health Information. I'm glad you're able to join us today. I'm Sean Corning, one of the Education and Outreach Coordinators with NNLM Region 7. We just have a few technical items to cover. All of the attendees have been muted, but we do welcome your questions and comments in the Zoom chat at any time. VFairs is providing the technical assistance today, and NNLM staff will be keeping an eye on the chat with me. Please make sure that you select everyone from the drop-down menu when posting your comments in chat to make sure that everyone sees them. When you're submitting questions for the speakers, make sure you use the Q&A function. This makes sure that they don't get lost in chat. We have a live closed captioner for this event. You can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event, HealthMisinfoNNLM. So before we get started, I would just like to share a little bit about who we are. So the National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at NIH. So the NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the NIH. It's also the world's largest biomedical library and produces resources like PubMed and Medline Plus. So NLM, that's us, is the network of the National Library of Medicine, and we serve as the education and outreach arm of the National Library of Medicine, and we work to ensure that health professionals and the public have equal access to health information. And the NNLM itself is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all that provide training, funding, and engagement opportunities to over 9,000 NNLM member organizations. So for this session, it's my pleasure to introduce our speakers, Vineet Arora, Sara Serritella, Aashna Sunderrajan, Kaitlyn Van Kampen, and Debra A. Werner. They're all from the University of Chicago, and they'll be talking today about training health professionals to evaluate resources, improve scientific communication, and address health misinformation. Thank you so much for speaking with us today, and I will turn it over to you.
Great. Can we have the slides, please? Okay, welcome everybody. And, you're here in the right place if you want to learn about how to teach health professionals to evaluate resources, improve science communication, and address health misinformation. And this is a very multidisciplinary panel. So I am a physician, dean for medical education at the University of Chicago, where I oversee medical education for our medical students, our 1,000 residents and fellows, continuing medical education for our faculty, and co-lead our simulation center. And I'm joined by a PhD research scientist, 2 biomedical librarians, and a science communicator and award-winning science communicator who also is a private detective. So I'll let you guess who's who as we go through the talk. But let's go ahead to the next slide. And thanks, Aashna, for helping me out here. So we have one funder we wish to disclose. Otherwise, we have no other disclosures. The funder was not involved with the presentation of the Association of American Medical Colleges, which contributed to the development of our curriculum. We go to the next slide. Wanted to just kind of highlight the outline. I won't belabor this because you're in the right place. You've been learning about misinformation. We're going to focus on how to teach about it. So if we go to the next slide. Also, just background for all of you, why now? So the Surgeon General has declared misinformation a public health crisis, actually asks health professionals and organizations like medical schools and other health professional schools to proactively engage with patients, and asks clinicians to use technology and media platforms to share accurate health information with the public. And this was even parroted most recently by Dr. Ashish Jha, who's the COVID czar, who talked about this very recently. So if we go to the next slide. How did we respond? And so moving on forward, next slide, Aashna. So feel free to keep pace with me. So in Illinois, I was part of a clinician group called IMPACT, Illinois Medical Professions Action Collaborative Team. And my team actually just spoke earlier today in this conference about their experience. And what did we do? You know, for those of you that were there, there'll be more and more that you'll have learned. I just wanted to give homage to one slide to say that a lot of what we learned in this community-based organization where we engaged clinicians from all over the city. For those who haven't been to the lovely city of Chicago, Cook County has the highest density of academic health centers in the country. So we're connected through the Institute of Translational Medicine, which you'll hear about. So we tend to to be partnered and to have one voice around medicine. The AMA is here, ACS, American College of Surgeons, is here. And so that's during the pandemic, we saw this and we thought, can we, instead of this cacophony of like single voices out on Twitter or Facebook or Instagram, can we all speak together and use a place-based approach to increase trust? Because people, if they saw me, would be like, oh, well, this is a doctor from UChicago. Oh, and she's working with a doctor from Rush, or a nurse from, UIC, and a pharmacist from, Advocate. And so how can we come together? So if we go to the next slide. What we did was we tackled misinformation. We worked with an extensive team thinking about infographics. This is an older slide. We have like over 100 infographics, but we didn't come at this like all things in medical education. We looked at the literature, what had been done before. So we borrowed from climate science, from the debunking handbook, and we looked at how to debunk myths from sort of this infodemiology perspective, where you lead with the fact, you also give the myth, but you give the why. And the why is so critical. Like my own family will think of a certain, myth, but I have to, it's not enough to be like, science says this. That's not going to be enough, not going to be trustworthy. You have to give the why. And so being on the inside of a hospital when vaccines first came out, healthcare workers, I was breastfeeding at the time. People are going to do it. Are you going to take the vaccine? And I'm like, yes, I'm going to do it. And also a lot of younger women were like, well, I've heard about infertility and I'm trying. And so, it turns out that, of course, that was a myth that was perpetuated, actually through disinformation. Because why? Because the vaccine spike protein does have a small section, a very minute section that shares, some protein sequences that with the placental protein, but too small to trigger an immune reaction. But for a non-science audience, like that could be overwhelming. And even this, we're talking about nurses, pharmacists, and doctors who were like, I don't know if I want to take this vaccine. And so, of course, we developed infographics. And when Nicki Minaj retweeted about this, I was like, hey, I'm a doctor, and look at this impact infographic. And we have partnered with the Society of Hospital Medicine, as well as Chicago Public Libraries, to train libraries in this approach, and a paper here that you can take a shot of to get more information about that, working with pharmacists as well. So if we go to the next slide. I'm going to just highlight that working together as a team is like teamwork's the dream work. And so you've seen a lot of healthcare professionals be on the media. We were all in it together. So it was like, if somebody got a media call in Chicago, we were like, who can be on first? And we still do that. And so this is just a smattering. This all started through women, actually. So I did want to just give a shout out to really, women together thinking with their mom identities, being like, how are we going to frame that mom identity as a trusted voice for the other moms in our community? So we now have a lot of other people in our organization, but it started mostly with physician moms. And so if we go to the next slide, why would we train healthcare professionals? Keep going, Aashna. So trust in healthcare professionals is high. I say that because a lot of people are demoralized after, I'm a frontline provider working 3 years in a pandemic. You're like, nobody trusts me. Nobody wants to get vaccinated. It's not true. If your own doctor recommends the vaccine, you're still more likely to get it than a celebrity. And when we look at ethics of professionals, if you look here at the top 5, you've got nurses, doctors, pharmacists, top 3. So that's really high. So next slide, Aashna. And this was just the slide highlighting that your own doctor recommending the vaccine is going to be most likely. There is a generational effect. So I do want to highlight that when you look at the 18 to 49 crowd, you know, the millennials, the people that I teach versus the 50 and over boomers, I'm part of that. So that we're more likely to trust doctors than the young crowd. And so if I have to reach the students, I'm not going to be like, oh, go to your doctor. Like they're like, I don't have a doctor, you know, so we're going to need to think of other ways to reach them. And that's where maybe opinion leaders, celebrities, you know, that come in. So if we go to the next slide, so how do you train healthcare professionals? And I'm going to turn it over to other folks, but I just wanted to start by saying, you know, using the lesson and impact. We then, when I got this job, July 2021, Dean for Medical Education, I started to think like, you know, we are not training people we are training medical students to talk science, right? We take lay people and then they graduate with a lot of scientific knowledge and being able to go to conferences and, you know, talk about research, but we don't train them to actually face the public and talk about to the public. And so that, working with Sara, who's here, we created, and leveraging some of the work she did, we created a new science communications track really at the Pritzker School of Medicine. This is just some of our op-ed success, 20 op-eds out of our class just this year alone, still more counting. Newsweek, Chicago Tribune, Chicago Sun-Times, Kevin MD, keep going. So Aashna, and then we have a 9-week course for medical students that we've developed, talking about the infodemiology, workshopping sessions, bringing in guest lectures. This was the course that's funded by AAC that we've also adapted for clinicians that Aashna will share. So next slide. And then our objectives for the curriculum. So partner with librarians to help students and clinicians evaluate online resources. So you're going to hear from Deb and Kaitlyn in a minute. Improve scientific communication skills and empower students to address health information with their patients and their communities. So even as early as first-year medical students, they have a community. They've got family. They've got where they came from, you know, and they're on WhatsApp, like they're hearing stuff. So they can actually use some of that to bring myths forward. So next slide. So I'm going to now turn it over, I think, to Kaitlyn, who's going to start us off.
Perfect. So my name is Kaitlyn Kampen. I am one of the librarians who came in actually to do one of the guest lectures for this 9-week course. And we really taught this class on evaluating online information or misinformation a lot of times in this case. And so our purpose there as the librarians is to teach the medical students how reliable information that they found online is, and how to determine if something is credible. So you'll see things like blogs, like tweets, like, you know, just random online articles that are out there. And so we want to go through and help them discover, how do you determine if this is reliable? Is this something you should continue sharing? Is this something you should not share? So that was our role there. So we really show these clinicians in training how they can evaluate this fact, or if it's fact or if it's fiction. So we also are really trying to emphasize when we are there in that course, not only doing this for themselves and how they can determine this information for themselves, but how they can also communicate it, as we said, to their patients, to family or friends who might bring them, you know, this tweet that they saw online, and show them also how they can use these different methods that we teach. So in this session, we primarily focus on the SIFT method. But we've also created a library guide that we, I think, show later on, that will focus on the CRAP test and the SMART check as well. So to give you a little bit of an overview of what the students learn in this course, I'm going to quickly go through the SIFT method that we have. This is an abbreviated version of what we do teach them in class. We also do have them stop and do examples for each of the steps of this method, along with, at the end, we split them up into groups and they do a group exercise on a prompt that we have to debunk an online claim. And then we also have them go through, they each pick a myth for this class as well. So we let them have some time to go through their own scientific myths that they have found as well. So a little bit of background on SIFT. It was developed by Mike Caulfield, who is a digital literacy expert at, I think, either Washington State University or Washington University. And this was really developed to determine whether online content, especially news and online media, if it can be trusted for credible or reliable sources of information. So this method allows for students, or in general people, to take a step back from the information that's presented to them and really parse through it. So the steps for SIFT are to stop, investigate the source, find better coverage, and to trace those claims, quotes, or media to the original context. Next step, please. So the first step is to stop. Before you read the article or information, be aware of any emotional response. Headlines, blog posts, anything like that, they're designed to get the reader to click, to get that emotional response out of someone. So we want the students first to consider, what do you know about this source? Is it trying to get you, to click it, to really attract your attention? So take a step back, think about it. What do you know about the source? What do you know about the information already? Next slide, please. The second step is to investigate the source. So this means that we want to look into the author or the source that is publishing that information. And we really encourage the students to go beyond just the About Us section on a website. As this, a lot of times it's going to be biased. It's only going to tell you what they want you to know. So you want to look laterally, as we call it. So use something called lateral reading, where you're going to look at what other trusted sources of information have to say about this original source. And we actually do this through Wikipedia. You can start and see, is there a Wikipedia page on this topic or on this group? And a lot of times that can give you a lot of information on it as well. And then doing this, it lets you see if this group has maybe an ulterior motive in their mission, or if they really have that authority to share this information. You can also use Google News and see if there's like a New York Times post or something like that on it as well. Next slide, please. The third step is to find better coverage. So see if there are other more reliable resources that can corroborate those claims. This we also can think of as like the fact checking step. So find better coverage or fact checking. We again encourage them, you can try to just Google it, but again, you might find more myths if you just Google it. So there are these fact checking websites that you can use. And these are things like factcheck.org, Snopes, Washington Post Fact Checker, but they have already done that work for you to check to see, is this information fact or fiction? It doesn't have everything, but it does have a lot of things. And we also like to remind the students at that point, you are health professionals in training, and you can go to that source as well. So if this is a medical myth, you can try to go to something like PubMed or a different database and try to find that original research for yourself, do some critically appraising of those articles and see, is this something that is supported by the research, or is this a false claim? Next slide, please. And then the final step is to trace the claims to the original context. So if there is a reference to research or a quote or something from someone, follow the citations or the links to find that original source of information and look how the fact was actually presented in its original context. So we encourage them to ask questions like, is the extracted information, does it actually support the original claims within the research? Was this information cherry-picked? Did they have a biased message that they want to send and they found the one quote within that article that applies to what they're trying to say, but the entire research article is actually about something else? So look to see what the context of it is. We also point out the game of telephone at this point, where a lot of times within there, you might have a blog that links to CNN, that links to the JAMA article, and by the time that you get all the way back, it's a completely different message than what it was at the source. And then we also encourage them at this point, if you are struggling with any of the steps, or if anyone that you're teaching this to is, contact an expert. This is where librarians can really be useful to help you try to figure this information out as well. Next slide. And then in this library guide that I mentioned, we also have 2 other methods. And all 3 of these methods operate in the same way, that we are trying to encourage that reader to more closely evaluate the source and the purpose of the information that was presented. So one of these is the CRAP test, which has a great name for people to remember. And this is an evaluation method that was designed by a librarian, Sara Blakesley, at Merriam Library at California State University, Chico. And CRAP stands for the currency, relevance, authority, accuracy, and purpose. And this really provides you with a method and list of ways to evaluate kind of that nature of the information that they find as well. Last slide. And then the other one is the SMART check. Similarly, this looks at the scope of the article, the motivation behind the article, the authority or accuracy of the author, the relevance of the content, if it's reliable, and then lastly, the timeliness of the article. So is that content current? So really the purpose of all of these is to just take a step back from that information that's presented, evaluate, is this something that should be shared again? And that's really what we try to get at with these different SIFT methods or others. And with the librarians coming and leading the session, the purpose is really to try to show these students these tools, and not only that they can use them for themselves, but that they can present this information to their patients, to their family and friends. That's what all of these methods were designed for, was really for everyday people to be able to take that step back and evaluate that information. And we also really try to encourage at this point collaboration between our different fields, between medicine and librarians or nurses or things like that. We really encourage them to reach out to those information experts if they ever come across shared information and they want help evaluating it for credibility. We are there to help them. And then I think it moves on to Sara.
Thank you so much. And hello, everyone. We're going to give you some science comm skills today and share some of the concepts that we teach our students. So I'm the Director of Communications at the Institute for Translational Medicine. We are part of the NIH's National Center for Advancing Translational Sciences Clinical and Translational Science Award Program, yay for acronyms. And we have worked really closely to build this program and help give scientists the ability, researchers, medical professionals, health folks, the ability to communicate. When we've built these programs together, we've seen the students have some really powerful impacts because we're not just having them learn the theory and then stop there. They're also practicing and applying it and putting together messy drafts and seeing how it's applied. I'm a lecturer at the University of Chicago in the Pritzker School of Medicine, and I am also, spoiler alert, the licensed private detective. Our family firm Vantius has helped exonerate many wrongfully convicted individuals and worked on some of the biggest cases of the last 10 years that you've probably seen in the headlines in complex civil and criminal cases. And with that, that keeps me firmly grounded in the non-academic world and working with a variety of populations, as well as being in the academic space and pulling from years of being a journalist prior to this life. Next slide. Thanks, Aashna. So there's one thing you walk away with today. Not only are you up against misinformation and disinformation, but our human attention spans have completely shrunken. So there are some now who would argue that the human attention span is less than that of a goldfish. So we teach our students the goldfish rule. If you cannot capture someone and engage them within a few seconds, it doesn't matter what is to come. You will not have the opportunity to inform and inspire and enact change and get them the real information. And there are several ways that we do that. Next slide. A shout out to the science of storytelling and Uri Hassan's work at Princeton. So he has found with putting the storytellers and listeners through fMRI imaging that brains actually start to have similar neural responses and come into alignment so that the brains of the listener and the storyteller actually start to almost mirror each other, and people can have a shared experience and have a biological reaction so that you can resonate with any audience. Next slide. It's so detailed that when you're talking about food and salty, juicy goodness or something sweet, then that sensory cortex in your brain and that listener's brain is going to light up. Same with smells. So a really powerful way to connect with people. Next slide. And there's a recipe. So I highly encourage everyone to check out some books. One from Jonah Berger at Wharton, Contagious. Another one, Made to Stick by Chip and Dan Heath, Stanford and Duke. There is a lovely recipe of how you can capture people's attention. One, using stories like we talked about. Two, make sure you are clear on the conflict. Oftentimes in academia, we step away from conflict. You have to embrace it because there is an emotional reaction where then people are more likely to share information. And with that, when you have those emotional responses, you're embracing conflict. You're actually building a team to help solve that conflict together. But if, for example, Romeo and Juliet had gotten together, their families loved each other and everyone lived happily ever after, that story would not have transcended time. So having that conflict is critical. Social currency, what's unexpected? Think about the last time you shared something. Highly encourage you to drop it in the chat. Think about it. Did you share something that made you look bad? Did you share something that made you look good, like an insider? You were trying to share with a family or friend something that could help them or make them laugh. We often share things that help us move our image forward in society. And so giving people the ability to be the hero in their own stories and sharing information is an approach that we talk about as well. tapping into the emotion, tapping into public, making it shared, it's easily accessible, giving practical value. So think about yourself as being the Yoda to someone's Luke Skywalker. People don't like to be told what to do, right? How well did vaccine mandates work? Not so well. When you can help people, give them information and come to conclusions on their own so that they can be the hero in their own story, it goes a long way. Triggers are things like, I say peanut butter, you think jelly, and simple and concrete when we're getting rid of jargon and we're really using analogies and being at an approachable 7th grade reading level is key. Next slide. Here's an example from Made to Stick. 37 grams of saturated fat. Scientifically precise, right? There was a nonprofit organization that was working to try to get people to understand just how bad buttered popcorn was at movie theaters and have them buy less of it because it was really negatively impacting their health. But if they were just going around talking about 37 grams of saturated fat, nobody cared. You say that to someone walking down the street, most people don't understand the context behind that, even though it's scientifically precise. So what they did, next slide, please, was they got greasy burgers and fries and put them down in front of a bunch of journalists at a press conference and said a medium-sized buttered popcorn at a typical movie theater contains more artery clogging fat than a bacon and eggs breakfast, Big Mac and fries for lunch, and steak dinner with all the trimmings combined. And that made headlines all across the country. It stuck in people's brains, and the impacts, people stopped buying buttered popcorn. It had such an impact on theaters' bottom lines that they actually had to go back to the drawing board and create recipes and change things. So impacting public health when you use these techniques can be very powerful. Next slide. But you also have to know your audience. What % of adults don't have the health literacy they need to navigate the health system? What do you think? Drop it in the chat. Guesses. And don't Google it. I know it's tempting. We're virtual. Throw in a guess. 70%. Thank you, Amy. Emily, 55. Kathleen, 60. Aaliyah, 90. Lori, 80. We've got all these great numbers. 100%. 88%. Ding, ding, ding. We have a winner, Helen. 88%. That means that almost everybody who's walking through your doors, almost everyone does not have the health literacy they need to navigate the system. And also when we're thinking about intent with the language and what we're using, there's some interesting facts out there about the people who are sharing this information online. For example, the Pew Research Center has found that almost a quarter of the people, Americans online, have shared made up news stories unintentionally. They didn't necessarily mean to, but they didn't know that it wasn't true, which is why what our lovely librarians talked about is so important. Also, scary stats. Stanford did some research. What % of high school students do you think were unable to distinguish between a news story and between an ad, even when the ad was labeled sponsored content? What do you think? Put it in the chat. Tomasita, 85%. Thank you so much. 90. Wow, this is looking really grim for the future of America. Jane, Heather, 95%, 98%. Well, at least we're a little better than that. We're about two-thirds, okay? This is why it's so critical to bring this education to everybody, especially our healthcare professionals. Next slide. And getting rid of jargon is so critical because not only do we need to get people at an approachable 7th grade reading level, the National Academies of Medicine have said health literacy, critical part of health equity. But science shows that when you use jargon, you actually make people believe in science less. Terrifying. So each and every word that you use can really impact people in a powerful way. Next slide. And an example of how we've incorporated all of these elements into a nationally award-winning campaign to increase awareness of and participation in research is Save to Humans. Highly encourage everybody to click on the link. So we've launched a platform that is like a match.com to connect people with health research studies. Obviously, a lot of people have not been involved in health research studies, less than 10% of Americans. So how do we make this normal and get the conversation started? We noticed during the pandemic that there were booms in pet adoptions. How many of you on the line adopted a pet during the pandemic? I am one of them. Adorable dog. So when we were doing this, you got 2 Tomasita. I love it. The more the merrier. We know, thanks to NIH research, that having pets, having dogs reduces your stress, right? And mental health was a huge problem during the pandemic. If you look at different data sets, we saw the conversation online from social media listening data that people were talking about mental health and stress just as much as they were talking about COVID-19. So we created a narrative where the dogs were mobilizing to save their humans from diseases and telling them they needed to sign up to participate in health research in this platform, and had the dogs sharing their stories about why they loved their humans, and had real humans, the real dog owners, share the health causes that they cared about. And this had huge organic reach, and within the first 30 days had a higher engagement rate than the All of Us initiative, which, as many of you know, spans the country and tons of partners with massive budgets, and that was with $0 ad spend. So when you create a curiosity gap, when you use narrative, when you get people talking and you use sticky elements, you can have a huge impact. And we're giving our healthcare professionals those skill sets so that they too can change the world. Next slide, and over to our next speaker.
Searching for the mute button again. So as Sarah mentioned, one of the most important aspects of our class was not only to teach our students this theory behind scientific communication and how to evaluate resources, but to put that in practice. And we did so, at least with our medical students, with infographics. So, Sarah, did you want to quickly jump in and talk about this?
Sure, we have a fantastic new Masters of Science and Biomedical Sciences program. And our wonderful visionaries like Dean Arora have made Science Comms a track in this program because we've seen the impacts on everyone's lives, both in impacting public health as well as people's careers and professions. And so you now have the opportunity to come join us for a 1-year accelerated special program. Take advantage of some really fascinating tracks like Science Comms, Biomedical Data Science, and Health Systems Science, and walk out with some really concrete skills and independent projects where you get to apply all of these things that we've talked about to real world health situations and communicating to communities and different audiences. So we encourage you to check out the website and connect with us if you're interested as we grow this exciting program. And Dr. Arora, anything you wanted to add to that before we move on?
No, well, we've gotten a lot of interest, and in preparing this talk, I know there might be some librarians on the line or others interested in science communication. So we just wanted to throw this out there as an opportunity you may not have heard of or to share with others. So please carry the word for us. So thank you.
Spend a year with us. You'll have a good time and learn a lot.
So in order to put this into practice, we asked our students to select a myth of their own, to develop a story to try to debunk this myth, to create an infographic so that they could visually communicate the story, and then come up with a dissemination strategy that they could use to share this with their community. So here's an example of 4 infographics, or here are 4 examples of infographics developed by our students. Typically speaking, students decided to choose myths that were relevant to their community. So these were myths that were commonly brought up in their family WhatsApp groups, or that were talked about in their rural communities. For the most part, most students decided to address myths related to the COVID-19 pandemic, as shown with these 2 infographics on the left, one about wearing a mask and one about taking Ivomec animal warmer. We also had a lot of students who decided to address myths related to diet and exercise, as depicted by this infographic on sugar intake and sugar consumption. And we also had a lot of students decide to address myths related to mental health, as shown with this infographic that says it's okay not to be okay, which I love the title of. So I thought it would be really useful to actually walk you through one of these infographics in more detail. And specifically, I'm going to walk you through this one about the use of Ivomec. So this student decided to develop an infographic on the use of Ivomec animal warmer as a treatment for the COVID-19 pandemic. So the infographic starts off with a question to engage the audience. Have you taken Ivomec animal warmer? It then proceeds to share a fact about Ivomec, specifically that Ivomec animal wormer is not approved for COVID-19 prevention or treatment and is dangerous to people. It then proceeds to emphasize or highlight the myth associated with Ivomec, that Ivomec will prevent or treat COVID-19 because it contains ivermectin. It then goes on to explain why this is why this myth is false. Ivomec has not been tested in humans to treat or prevent COVID-19. That's warned that taking Ivomec can cause vomiting, seizures, and even death. And finally, the infographic ends with this caution or takeaway. In reality, taking Ivomec could make you sick and more susceptible to COVID-19 infection. So using the skills that Sara talked about, this infographic uses this fact-first approach, uses this hook to first engage audiences, and then uses this fact-first approach and this repetitive strategy to help readers distinguish fact from the myth, so that what they're taking away is that maybe you shouldn't use Ivomec because it shouldn't be used. So after developing this curriculum for medical students, we were wondering whether it was possible to adapt our curriculum for other health professionals. And so we received funding through the AAMC grant from the CDC to adapt our curriculum for practicing nurses and pharmacists. Keeping in mind that the needs of practicing nurses and pharmacists are different from those of medical students, both with their workload and their schedules, we decided to turn our 9-week course into a 3-week course. We also decided to use a combination of synchronous and asynchronous methods to ensure that if there was anyone who was unable to attend one of these sessions, that they could still engage offline. And we also placed an emphasis on different types of dissemination strategies. For example, flyers, because these were people who were actively seeing patients in their day-to-day life. And so a flyer or a handout or even like a poster may be more useful that they could like physically show or hand to patients rather than an infographic. So this is an example of one of these handouts that one of our nurse practitioners developed. Not surprisingly, all of the learners in this adaptation of our curriculum chose myths that were based on their own clinical experience. So in this example, we had a nurse practitioner who decided to address a myth related to ER care when you're pregnant, because this was something that she realized a lot of her patients had been asking her. And I should preface this by saying that this course was hosted or run in the summer of 2022 when all of these issues related to pregnancy and stuff were very prevalent. We also had a pharmacist who decided to address a myth related to the safety of over-the-counter medications, because she found that a lot of her patients had this erroneous belief or false belief that because this drug or medication is available over the counter, that was always going to be safe and that they could take as many as they wanted, regardless of the sort of multiple medications and side effects. So finally, we were also really interested in actually evaluating some of our curriculum work to see whether it was effective, whether the curriculum or the students found the curriculum relevant, and whether the students actually learned some useful skills that they could take away outside of this course. So these are results, this is early data, I should say, specifically from the nurses and pharmacists who took part in our 3-week course. We had 14 of them participating, and we asked them both before participating in the course and then after participating in their course to identify their confidence in identifying misinformation, their confidence in using evidence-based strategies that we've taught them to address misinformation, and their confidence in creating infographics or other type of media to try to correct this misinformation with their patients. And we found that across all 3 skills, confidence increased from baseline, as depicted by this solid maroon graph or bar, to follow-up, as depicted by this striped graph bar. And in all cases, the increase was significant. We also asked our nurses and pharmacists to evaluate the course in general so that we could get a sense of how effective or useful it was. And we found that 41% were completely satisfied and felt that the course met all of their needs. 47% found that the course was relevant to their current role and position in healthcare, and subsequently were likely to recommend the course to their colleagues. But what we found really useful to us as sort of feedback was that 65% said that they plan to use the techniques discussed in the course in their day-to-day life. So what this shows us, or what this showed us, was that this course was useful in teaching skills beyond the classroom, that the skills that students were learning, and in this case, the pharmacists and nurses were learning on how to evaluate online resources and how to communicate scientifically and effectively with their patients, were skills that they found really useful and effective, and things that they were going to take away outside of this course. Vinny, would you like to?
Yeah, so I'll bring us home. So let's go to the next slide just to think about wrapping up and lessons learned, so we can get to the robust level of questions that people might have. So, we have discovered there's vast interest and need among health professionals to learn more about addressing misinformation. And, I'm sensitive to the fact that, like, we've talked a little bit about infographics and storytelling. Those skills we also teach so that people can use in practice. And so when you teach a nurse or a pharmacist or a resident about this, it's not just that they're like, oh, I learned how to dispel this one myth and use fact checking and lateral, information pulls, and how to embed it in a story to yield better memory retention and persuasion. I'm also going to be able to talk to my patient. And when they ask about COVID, when they say I'm not getting vaccinated, I mean, I've done this. I say, oh, tell me why. What have you heard? Right. So I don't go in upset that I'm going to uncover a myth. I actually look for the myth so that I can say, okay, let's talk more. Where did you learn about that? Okay, then I kind of think about it. And, I happen to be a hospitalist. So then the next day I can go back and say, oh, well, here's some more information, and how can we kind of use that to build trust? So we do think collaborating with librarians and others are a really integral part of the educational program to address this. And I did want to give a shout out to the impact work with Chicago Public Libraries, which was through the All of Us campaign, which Werner helped us with here. And so if any questions about that, we can talk about that. And then even a short curriculum on misinformation, like a micro module. So the 9-week course we do for students, it's elective credit. We have about 20 students a year that take it. And then the mini course that we do for practicing clinicians, I mean, that's like we're doing it in like sessions on the fly during lunch or at 4 or 5, 2 or 3 at a time, with about 20 people as well. And that's usually virtual, and people are calling in from clinic, wherever they can make it. And that was also funded by WMC. So if we keep going, wanted to leave you with leave behinds, so I've been to many talks and many workshops as an educator, and I know that you guys are probably here wondering, well, where do I get started? And so our goal is to leave behind tools for you to get started. And so the first is our library guide, which we put the link in the chat, which you can see directs you to Crayar Library, and you'll see the SIFT method, the CRAP test, the SMART check, and then how to evaluate resources and fact checkers, so that you can just use that in class. Like you can just say, hey, direct people to the library guide. And then the second is, at least to start with thinking about infographics and how to dispel myths. We've sent you to our website that like showcases some of our students' work, as well as some of the early wins that we've had. I know there are some questions about, are we recording? So in our newest rendition of the AAMC renewal, we actually put in the money to create CMU modules, because you don't know what you're doing initially. So this time we're creating web modules. We have the money. We're going to get them CMU accredited through University of Chicago. And then we're going to post them online. So once we have those, we'll be able to share them as well. And we'll also link them back to our website. And so if we go to the next slide, I also wanted to also provide a screenshot for anyone who wanted more information about where to learn more. Our group published recently in Academic Medicine in a special supplement about how to improve doctor-patient communication around empowering physicians in science communication, particularly around infographics, op-eds, as well as video. We also have published a book chapter with colleagues at AAMC on addressing medical and misinformation with other grantees. We have several papers related to impact, the place-based approach, and then one paper looking at our partnership with clinical librarians, Deb and Kaitlyn, on how to answer clinical questions during rounds, and really, again, how to really impart and empower to have librarians as part of your team to increase trust. So with that, I will open it up for questions, and feel free to use the Q&A, and I'll be the moderator and just call things out. And so I do see one question here in the Q&A, which I'll direct to Sara, because it says, what strategies do you use to teach storytelling, Sara? Oh, and Sara, you're on mute. We want to hear your story.
So we use a combination approach. We both have students experience the power of storytelling and give them the ability to practice it. And I think one of the most important things as we teach is encouraging people that this is an iterative process, that first drafts, their first attempts at trying to weave in the storytelling, they're probably going to be bad. There's a reason why it's called a writing process. And by the time we all get to this stage and, academia and healthcare, a lot of us can be perfectionists. And so being able to let go of that and practice it and then try it out with the different audiences that we're trying to reach. So it's really a muscle, just like you're not going to go lift, 500 pounds at the gym in one day. You need to work your way up. There's a lot of iteration, and we break down each of the elements of what goes into a powerful story and how you can apply that to different formats. So whether it's the infographic, whether it's video, whether it's through talking to somebody and giving a presentation. So the cool thing is that each of these magical parts of storytelling and the science of storytelling can be applied to a bunch of different platforms. And that's what we're really excited to give everybody. So feel free to jump in with follow-up questions. That's a high-level overview.
Great. I have another question from the chat, and so feel free to, I'll moderate both the chat and the Q&A. So this question, and we'll direct this actually to our librarians, because I think this is an important question, which is, has anyone else had to get back to the basics with their peers of discussing data and logic? Sometimes that's super helpful, reminding them of what they learned in school. I'm speaking from a nursing approach. And so Kaitlyn, Deb, anything you have to add from there and like basic building blocks they need before they come into learning about how to dispel misinformation?
Kaitlyn, I don't know if you want to answer this. We just taught this session on, what was it, Monday. So during that session, we didn't really have to go back, I think, to the basics too much. And I know the questioner comes from a nursing background, so I'm not sure if she had something else, or she or he had something else in mind. But we do have to talk a bit about, when we're talking about evaluating resources, we do talk about thinking about the possible agenda or bias of the site that we go to, and keeping that in mind, and evaluating what you're finding based on what a particular organization's agenda might be or what their bias might be. So really kind of thinking about these sources critically in that way. I'm not sure if that really answered the question, though.
And I can jump in and also say that for our students, sequencing as part of the curriculum is very important, right? So for the students, they've taken a whole class on medical evidence before they get to the 9-week course. So we would not flip that. So they already know how to do a lit search. So when we're introducing them to these other, fact checkers and say, go to your, lateral sources, go open PubMed. They know what PubMed is already because we've already told them. Having said that, for the practicing clinicians and the residents, I think that's where the refreshers are needed. And so Kaitlyn, maybe you want to highlight what your experience has been refreshing people about some of that, knowledge,
Yeah, so we do come in usually during the summer, and we'll teach just clinicians, like the interns and residents when they first come in, We'll try to go to their programs and teach them how to use things like PubMed again. But I'm embedded with clinicians as well. So like Vineet was saying, we go on rounds. So I do find actually that even on rounds, I'm doing a little bit of teaching while I'm there with a lot of the either medical students or residents, kind of showing them some of the resources I'm using, whether it's PubMed or UpToDate or different apps or things. So a lot of times we do kind of have that where we have to remind them how they can find those resources and things. So
great. And I will also go on to the next question. Do the students put their final projects on CV or are they published? So Sara, do you want to take a little bit of thoughts on that, and then I'll chime in?
Yeah, absolutely. Thanks. So the goal is that their work goes into the real world. So whether it is a social media infographic that is being posted by them and or our resident influencer, Dr. Arora, and being shared, whether it is submitting for an op-ed for publication, maybe they don't get accepted to the first publication they pitch to. That's okay. Pitch to another one. Videos, we have a YouTube channel, post them there, share them online. So absolutely. The goal is that it lives beyond someone just listing it on a CV, that it's out in the real world, having interactions with people. And then it's a great learning experience because people can see firsthand from the comments and what's working, the little strategic elements that they put in and if it landed. So it's a wonderful ecosystem from start to end. It's not just an exercise for the sake of exercising. People are picking topics that they care about, problems that matter to them, so that they are empowered to use these skills to have a real world impact. Over to you.
Yeah, and I would add, that's why they've got to pick myths that are meaningful to them. And they often pick things that are related to their specialty of interest or to their community or to their family. And we actually encourage them, if they do an infographic, we say, who's your community, or really for all of them, who's your community and what's your strategy? So if it's an infographic, it's like, are you doing an Insta? Are you doing a TikTok? A lot of them actually now are like, a few more are like, I'm going to try TikTok. When we first started, it was like, I'm going to do Instagram. So we're seeing some interesting social media changes as well. And then some are like, I'm going to do WhatsApp because, my family is distributed just like mine all over the world. And we have this WhatsApp channel and that's where I'm going to go. And then we ask them, how did it go? So we follow up with them and be like, did you share? What happened? Did you inspire those discussions? And so it's really about empowerment, not just around their project, but also, are they going to use the skills in practice? And then obviously, we didn't discuss op-ed writing, but our students, they have just taken that up, in droves. And obviously that's a product that they then do list on their CV. So they do like that as well. And then shout out to Dr. Bloomgarden, who teaches science communication with us and spoke earlier today. She's in the audience and also putting in our website. So she's an endocrinologist, a specialty rife of full of myths, starting with things like just how to balance your own weight and hormones and things like that. So another great resource that we've been able to use to help our students. So I think we're kind of nearing the end. I see a few other questions I did want to get to. And then, at least I want to reference one thing that came up earlier, very early along somebody had asked a question: how much personal flack did you all get for your online advocacy and how did you handle it when I was discussing impact? And so, and great question, because Dr. Bloomgarden's here and perhaps she can throw some papers into the chat. So, when we came together, the idea was, we can all come together as a team voice, but we can also help each other. So if somebody was getting attacked online, they didn't need to be alone, right? We could come to their aid. And, especially with the Surgeon General call and being like, you should be addressing this information, who has time? I'm tired. I've got a lot of other things going on. And now if I post something about, quote, anything, related to COVID, I'm probably going to get attacked. And I need to think about that. And so how can institutions protect healthcare workers? How can professional societies protect healthcare workers? How can boards and others, I'm a member of the ABIM, how can they play a role, and also state medical boards? I think those groups are all very critical. And so a lot of that work is going on now. So I just wanted to say there is a playbook. We have a toolkit on our website at Impact on Online Harassment. The U Chicago Provost has actually just issued another toolkit around online harassment that I contributed to. So, and then we've published on this topic. So the key really is supporting clinicians who are doing this work so that they don't feel like they're alone. And oftentimes, yes, you might need to lock down and let the dust settle and pass. But a lot of people, in my experience, when they start off in social media, like experts in social media, don't get deterred by one or two trolls, right? It's like, if you're going to say something, there's always going to be somebody who disagrees. And my God, I'm a dean, right? So somebody always disagrees with me. But it's really being able to have that civil discourse and dialogue. And for those that don't want to engage in civil discourse, I just ignore them. And now, having said that, being quote tweeted by a very, intended person, right, to their audience would generate a lot of hate. And that's where we sometimes will say, let's lock down your account, let's move on, let's, let the dust settle and it will go forward. And we've had to do that as well. But being part of the team helps, because then others will carry the torch and then you can come back. The news cycle goes so quickly, as just think about this week, that people don't care about things more than 10 seconds or 8 seconds. It is, Sarah, with the goldfish, right? So pretty soon, a day later, everyone's pretty much fine. So thanks, Dr. Bloomgarden, for those great links. And then I do see a question here that another person asked about lateral reading from SIFT. If I search for a debunked claim, I see 9 other sources repeating the claim, and that could be confirmation bias. How can SIFT guard against this issue? Deb, I saw you had a great answer. Do you want to just summarize it for folks that might not have seen it?
Sure. Yeah, I just wrote that the last step that Kaitlyn mentioned, the trace step, can be really helpful in this, to really link back, find the original information. So wherever you are, if they're citing some information, where did that originally come from? So trace it back, because things can be taken out of context. And as Kaitlyn mentioned, it can be like a game of telephone where, you're citing from a site, and then it no longer has the initial meaning that it had. So that step can be really helpful in that process. But we also recognize this does take some time, it truly does take the desire to want to know where this original information came from. I mean, if somebody just wants to confirm what they already believe with these other 9 sources that you mentioned, then they will do that. But if they have a genuine interest in finding out where the information originally came from, that's a technique they can use. I don't know if anybody else wants to say anything else about that.
Great. And then, another, I'll go into the last question because it's 4:26. And so, do you train healthcare professionals on best practices on being an influencer? So that's a really interesting question. And I would say that, as a dean for medical education who works a lot on professional issues, what we worry about a lot is perhaps getting into the fray when you're not prepared. And so we do speak to a lot of trainees and faculty and staff about just being cognizant that when you're posting something, it's reflecting you as a clinician, you as part of the organization. And at the very least, no HIPAA violations, no FERPA violations. So you can't, post people's pictures without them, knowing that that they're being posted. You can't post patient information, including date. I mean, even saying like, oh, I took care of a patient with, disseminated neurosarcoid yesterday, at U Chicago Medicine. That's a HIPAA violation, right? Because it's date and rare case enough for a patient's family to be like, that's about us, So really we kind of take a much more approach of early. It was like, get your ground rules. What are your guardrails, right? And then allow people within those guardrails to be like, well, what's your goal? And we've taught a lot of seminars here with another group, including Sara as part of that, about like, what's your goal in being on social media. And mine is really about medical education. Somebody else's may be about like growing their inflammatory bowel disease practice, or, increasing, their prominence of a research study, right? Like Sara was describing. And so when we go back to your goal, then we're going to highlight, well, how are you going to tell that story so that it's appealing to others? And so I don't personally like the word influencer because I think that it kind of highlights this sort of commercial aspect, especially around Instagram and, you know, buying things, which I think is really disconcerting. So I sort of highlight, how can you use social media well to advance your cause, and so there's some interesting references around that for those who have not read. One of them is in the Journal of Hospital Medicine on mission-based tweeting. So take a look at that. It's a beautiful paper by some of my colleagues, not me, who worked on this. So so with that, I see that we're right at 4:29. So I want to thank our really amazing panel, and also the NLMM team, as well as all of you for being so engaged and going on this journey with us. And please do reach out to us. I think Aashna put in her email, and feel free to link with us on Twitter. I'm at Future Docs, and we can put our handles into the chat as well. And we look forward to hearing from you and also helping support you in this mission. So thank you all, and hope you have a good rest of your conference.
All right, thank you so much for that great talk. I just have a few items before we end today's session. Thank you so much to the audience for joining us for the last session in day 2 of the NNLM Virtual Health Misinformation Symposium. So this is our last session. We look forward to seeing you tomorrow at 11:30 a.m. for our closing day keynote. And before I wrap up, I want to encourage people to have their organizations join the network of the National Library of Medicine. Membership is at the organizational level, not the individual, and this is how you can get involved with funding opportunities and various other taking advantage of various other aspects of the network. And also, finally, if you're interested in continuing to explore health misinformation, we have a health misinformation webinar series that will be continuing about this topic after our symposium. The first of these is going to be April 13th, and you can find more information on the nnlm.gov/training site. Thank you so much, and have a great rest of your day, and I hope you can join us tomorrow.